I'm Dr. Jenna Schwibner. I'm a dentist in Vero Beach, Florida, and I've been practicing for 12 years. As a doctor, your goal is always to help people and make a difference in their life. My passion and what I do is helping people breathe and thrive and be the best version of themselves. As a mother of 3 beautiful children, I'm also always concerned about them and their development, which led me to start learning more about children and how to treat children in my practice. Unfortunately, none of my children were able to breastfeed and had bottles and pacifiers. I always knew that was going to create issues with their teeth, but I figured as a dentist I could fix that. What I didn't realize is that not only could it affect their teeth, but also their jaw development and their breathing and their growth. So when my 2-year-old, who seemed perfect in every way, was having nightmares every night, we did everything possible to help him sleep better, and he still was having those nightmares daily. I happened upon a dental course that started talking about children, their breathing and their sleeping, and they recommended these appliances that the child wears at night that helps them breathe and in turn helps them sleep better. I gave him a Healthy Start appliance. I tried it out, and sure enough, the nightmares stopped. Seeing that, I knew that we were onto something and I needed to learn more so I could help my children breathe and thrive. And obviously, if they're sleeping, me and my husband were sleeping better too. I started diving in and learning as much as I possibly could about airway and growth and development so that I could help my own children. But once you learn and you start seeing how it's helping your children, you can't help but want to change the world and help every child you see. One kid at a time is my motto, but part of wanting to do these videos and share this is because I want to be able to get it to more kids that might not end up in my chair. So it's really important to educate and have moms know that there are options for their kids. Most people don't know how to identify the issues and don't know that it's a problem and what it can lead to later on. So there's a lot of misinformation out there. Unfortunately, the basic curriculum in dentistry and in medicine, even the specialty fields, the ENTs, the pediatricians, the orthodontists, they're not trained to look for these signs and symptoms of sleep-disordered breathing, and they're really not taught to think it's a big deal. We commonly hear that they're gonna grow out of it because that's what they were told. So I've done a lot of advanced training in this. One of my goals is to educate them and help those doctors have a resource to go to. Honestly, some of the most educated people that I see are the moms. And as moms, their job is to get their kids to grow. They are just on the internet researching and they find the information, they find the research articles, and they drive 2 or 3 hours to find me. And I hear every single day just how happy they are that they finally found someone that agrees with me that their child has an issue. Not that they want their child to have a problem, but they know their child has a problem. They know their child isn't breathing well, they're not sleeping well, and they want to know what is wrong. Because if they know what is wrong and they have a diagnosis, then we can work towards a solution. It's amazing, but I have parents crying in my chair saying, "Thank you so much for telling me that I'm not crazy and that my child actually has an issue that is treatable." 9 out of 10 children have at least one sign or symptom of sleep-disordered breathing. We just have to be looking for them. Unfortunately, only about 1% of dentists are trained to identify these and know what to look for. And it's much easier to prevent significant growth issues from happening than to treat it once we're at end-stage disease, such as sleep apnea as adults. That has led me to look younger and younger and start treating kids as early as we possibly can so that they don't grow up to be a sick adult. One of my favorite things that one of my mentors said was, just because it's common doesn't mean it's normal. And I like to change that to, just because it's common doesn't mean it's healthy, because I hate telling someone that something about them or their child isn't normal, but it's definitely not healthy. So genetically, we have evolved to have underdeveloped jaws and smaller airways. And this unfortunately is something that's not gonna go away, and it's getting worse with time. Part of that is just simple evolution and our diets and modernized culture. Couple things that have led to that are us eating softer foods, more processed foods. So even if we eat a healthy diet, it's still westernized. It's still softer. We're not going out and being a caveman and fighting for our food and eating it raw. So our muscles and our jaws don't have to work as hard as they used to. And so with muscles not working as hard makes the bones not develop as well. So we see that with anything. If we have a cast on our arm and we don't use it for a significant amount of time, the muscle atrophies. So if we don't use our jaws, that muscle is going to atrophy and then our bones are going to be underdeveloped. 9 out of 10 children have at least one sign or symptom of sleep-disordered breathing, and the main things that you should look out for in your children are nightmares, teeth grinding, bedwetting, difficulty in school, ADHD or ADD symptoms, chronic allergies, restless sleep, dark circles under their eyes, mouth breathing day or night, daytime drowsiness, snoring, or aggression. What we see is when we start treating these children with these airway underdevelopments, they grow. They have growth spurts. It's all about the airway. It's all about breathing. If your child or you aren't breathing, you're not getting the oxygen that you need to your brains. And if your brains don't get oxygen, your brains don't develop the way that they should, and the rest of your body is gonna suffer. We add that to the chronic sickness that we have. Everyone knows, especially if you have children, they're always sick. And allergies and pollutants and everything in the air that's constantly making our kids sick, they can't breathe through their nose. So you combine not being able to breathe through your nose with an already smaller jaw, it's going to lead to chronic underdevelopment and poor tongue position. It's all about where that tongue is. And when our children can't breathe through their nose, they resort to mouth breathing. When they're mouth breathing, their tongue is not sitting at the roof of their mouth, and they lead to underdevelopment of both of their jaws. The more I do this, the more I'm blessed that I get to see many patients every day for sleep consults. And for me, a sleep consult and an ortho consult go hand in hand. When I see a patient, we're looking at their bite, we're looking at their habits, we're looking at their sleep, and we're looking at their anatomy. We have a CT scan that has extremely low dose radiation that we're able to use on every patient that comes through our door that's about 5 and up. When we do that, we're able to see their sinuses, their nose, their anatomy, and make sure they don't have any obstructions to nasal breathing. Then we look at their teeth, the relation of the teeth, how wide their arches are, how narrow their arches are, if they have any crowding. And then we look at their habits, and we have questionnaires that we go over. How are they sleeping? How are they acting? On children, is there aggression? How do they do in school? Are they chronically ill? A lot of times we have to refer to our specialists. So we have a team approach. We work with our myofunctional therapists, and they're gonna do a full functional evaluation to see how that tongue is working, how the lips are working, how all the muscles in the head and neck are contributing to the growth of the teeth and the underdevelopment of the jaws. And then we will turn to our ENTs and our pediatricians to give us some information about the chronic sickness that these children might be having, or adults, and the constrictions that they have in their nose or their airways. Prevention is personal for me, and I always feel that being proactive instead of reactive is the way to be in life and in medicine. And for me, I'm living proof of that, as unfortunately my family carries the BRCA mutation. Many of you may know because Angelina Jolie also has that, and she was very public about it, and talking about how now the latest research is saying there's an 87% chance of getting breast cancer with that mutation. There's the watch and wait, and then there's the surgical early prevention, which is the option I decided to do. So surgical intervention with mastectomy and hysterectomy, for me, was taking control and preventing cancer from being part of my life. So I take that and put that into everything that I do for my patients, is that if I can prevent them from having a life-threatening condition such as sleep apnea and breathing disorders, I'm gonna do everything I can to do that. To learn more about airway-focused dentistry and how that could be impacting you and your family's health, please follow me and watch more of my videos.